just kind of going through the same format that we've done over weeks past. This is the heat map for the United States. We've mentioned before that Nebraska is not releasing comprehensive countywide data. We've been looking at the number of counties and the high transmission rate, and I believe last time we spoke it was at 93%, so we're still seeing an increase in the number of counties that are considered high transmission throughout the United States. As far as the 7-day moving average of cases, it continues to trend upward, although the slope of the curve is starting to flatten a little bit. Looking at hospitalizations, we've also seen a pretty high degree of hospitalizations. It does appear to be plateauing in a little bit, but as we mentioned last week, we are one of 4 or 5 states that have the highest hospitalization rate since the beginning of the pandemic. We've also seen an uptick in deaths due to COVID. In Washington State, the case rate continues to go up, although it does appear to be flattening a little bit. When we talked to you last week, the case rate was 534 per 100,000 over 2 weeks, and now it's gone up to 572. Looking at some of our neighbors, as I mentioned, we are starting to see a little bit of a plateau in the case rate. That was Benton County. This is Franklin County. A little bit of plateauing even on the west side. King County starting to flatten a little bit. Pierce County, same thing. Snohomish. But Walla Walla continues to have a similar shape. Not as a high rate of rise compared to other counties. Over the past 5 days or so, our daily case rate has dropped slightly. So we're hoping and praying that we're at a plateau for case rate, but it'll probably take a week or two before we can start seeing that. As we have seen at other times, you can get a little plateau and it can spike up again. So time will tell where this goes. Looking at cases by age across the state, most of our cases are in people between ages 20 and 50, and this is pretty much mirrored in Walla Walla. The highest group is age 20 to 34, and then but that 20 to 50 age group is a really important age group to focus on vaccines and also preventing spread. This is the state county hierarchy of COVID case rates. This data was all pulled off of the DOH site on yesterday is when I pulled it off. And just a reminder, all this data lags by about a week or so. We rank 17th in the state for case rate. With regards to hospitalizations, as I mentioned, we're one of 4 or 5 states that have the highest hospitalization rate to date during the pandemic. This is the entire Washington state. When we reported last time, it was 13.2 over the prior week per 100,000. Now it's gone up to 16.6. This is, some of our surrounding counties' hospitalization rate, pretty high. Franklin County, high. Walla Walla, we're mirroring almost what we did back in January, but again, just to reiterate the fact that it's not just a case rate of COVID cases, it's the whole package. It's the staffing issues, it's the non-COVID hospitalizations as well. This is the hospitalization rate ranking, and Walla Walla County ranks 17th. And while I'm on hospitalizations, Commissioner Kimball, you asked about mitigation measures for staffing and last week, and we did talk about this a little bit earlier today on the Unified Command call, but I did speak to Dr. Hall at Providence St. Mary, and some of the strategies that they're using to help get through this critical time period in our hospital system is to employ a team-based nursing model. And in that model, they're changing some of their workflows. They're changing some of their documentation requirements. They're also using administrative staff as a manpower pool to do some tasking around the hospital, things that don't require clinical expertise, and so they're doing a lot of multitasking. And they're also always trying to acquire traveling nurses as part of that strategy as well. You know, Washington State deaths have increased as well. And moving on to vaccines, we have seen a slight increase uptake in vaccinations across the country. This is United States data. Likewise, we're seeing a slight uptick in Washington State, and also in Walla Walla, just a very minimal rise in vaccine uptake since probably May. We ended our fairground mass vaccination clinics on May 16, so it's been a steady decline, and then probably around end of July, a slight uptick in the weekly vaccines that people are getting. This is the ranking of people getting vaccinated. The 12-plus population is the eligible population for vaccines. Walla Walla ranks 15th in the state and 4th in Eastern Washington. And this is just the remainder of the counties. And so last week we had 11 vaccine clinics, and just to show you the poor return on effort, we were able to give out 284 vaccines. 95 of those were the first dose. 105 were the second dose. We gave out 29 third doses, and just a reminder, those are the doses for people who are immunocompromised. It's not a booster dose, it's declared a third dose. And then of those, 55 were Johnson & Johnson. We did, about a week ago, we were concerned about that J&J vaccine availability, and we were able to procure a lot of J&J vaccine, and we've had to send some of this on to other communities, but we do have a sizable amount of Johnson & Johnson. We did have a presence at the fair, and our Department of Community Health was there Wednesday, Thursday, Friday, and out of those 3 days, 21 people opted to get vaccinated. And then Saturday, Sunday, the caravan over 2 days gave out 27 vaccines. So, still pretty disappointing numbers. We also, obviously been pushing getting vaccinated. That's been our main focus, and having availability of vaccine clinics. But, just in the long term, trying to get out of this predicament, that's our best long-term solution. We likely will require boosters over time. It's still free. That may change. I have not received any details, but it may not be free forever. And just to let our community know that it's easily accessible. And we're working on even increasing accessibility even further. Also, just with the hospital system being under stress, just really reinforcing the message of smart masking. Even if you're outdoors, if you can't socially distance, it's smart to go ahead and mask up. Social distancing is important, and if you're feeling ill, we're asking people to stay home and get tested. We've talked before about the reproductive number of the Delta variant, and these measures here lower the reproductive number. So the effective reproductive number is much lower if we can slow down the spread. And fewer cases, so if we slow the spread, fewer cases mean fewer hospitalizations, fewer ICU admissions, fewer people on a ventilator, and fewer deaths.